Welcome to this short training module on caring for staff and volunteers remotely in COVID-19. This is an additional module to the basic training on psychological first aid in COVID-19 for staff and volunteers in Red Cross and Red Crescent National Societies. It is developed for people who have taken part in the basic training and have foundational knowledge of PFA and how it can be applied during COVID-19. The aim of this training module is for participants to learn about how to provide care and support to staff and volunteers remotely during COVID-19. The training module starts with an exploration of the particular risks to well-being faced by Red Cross and Red Crescent staff and volunteers working during the COVID-19 response. Different ways of providing support are introduced, and attention is paid both to individual support and group support. The training also looks at setting up peer support and buddy systems, and ends with focus on supportive supervision and monitoring and evaluation. Participants also watch some short videos by team leaders, providing information and tips on how to provide support in this time. Let's start by looking at what some of the risks to well-being are for staff and volunteers during COVID-19. Pause the video and write down what some of these risks are. It may help to think of personal and interpersonal risks, and risks related to working conditions. Here are some of the examples I came up with. The first and perhaps most common risk faced by all staff and volunteers today is a personal fear of infection. This is particularly relevant for staff and volunteers that are still working in face-to-face settings. Another risk to well-being is difficulty balancing work and family demands. At this time, this is complicated by the risk of infection, as it may lead to a fear of infecting family and friends if working face-to-face with vulnerable groups, and it may involve separation from family and one's usual support network. Another important risk to be aware of is that many people working as frontline responders are facing stigma and discrimination by community members, as they are afraid that Red Cross or Red Crescent staff or volunteers may bring a higher infection risk into the community. Risks to well-being related to work include difficulties in adapting to new work conditions and tasks. Some staff and volunteers may be working face-to-face but with physical distancing and having to wear personal protective equipment, which can be uncomfortable and may raise feelings of anxiety. Others may now have to complete all their tasks working from home, which can be a challenge if their family and children are also in the home and need care and attention. Some may also have been given new tasks which are difficult to complete because they've not been in this unusual situation before. Some staff and volunteers may also have been given new tasks while still having to complete their usual work, which can feel tiring and overwhelming. Others may feel a sense of guilt over not being able to complete their work to usual standards, or having to choose between work and family. Frontline workers who are helping to provide care for people infected and ill with COVID-19 may also be put in the very difficult situations of having to make choices about who gets what support due to limited resources. This can lead to immense feelings of guilt and moral dilemmas. Common reactions to COVID-19 were explored in the basic training on PFA for COVID-19. Staff and volunteers working in National Red Cross and Red Crescent societies are nearly always part of the same communities they work in. This means they are facing the same challenges as everyone else, and it can therefore be expected that they have the same reactions as everyone else. Some examples of common reactions include the ones listed here: fear, anxiety, anger, confusion, sadness, and grief. In addition to these reactions, it can also be expected that staff and volunteers may feel high levels of stress and exhaustion because of their work tasks. It's important to keep in mind that many people are not able to take part in the activities they used to reduce their stress. For example, many people are not able to exercise in the same way or see friends and family. This means they also have reduced opportunities for physical touch, such as hugs or handshakes, and they may also not laugh as much. Both physical touch and laughter are important for us to manage stress. During this time of physical distancing, we've had to move to new ways of supporting one another, and many people are now providing support remotely. Although there are still some helpers working face-to-face, such as healthcare workers and other responders, remote support through phone calls, video calls, and short messages on the phone are common in all countries today. Discuss the preferred mode of communication with staff and volunteers. In some contexts, phone calls may be the only option, but in other locations there may be a range of platforms available. Do not assume that all volunteers know how to work specific technologies. When we know we're going to provide support to others remotely, such as in this COVID response, there are specific things we need to prepare to enhance the success of support we give. One example is to try to find a setting where you can communicate with the person in distress privately and with little or no disturbance. So, you need to check your environment where you're planning to provide support from. What are other things you can think of that are important to do in preparation for providing support to others remotely? Here are some things I thought of that are important to prepare when we're going to provide remote support. In addition to having a space to talk where you can have a private and confidential conversation, it's also important to ensure you have enough time to communicate adequately with the person in distress. Make sure that the equipment you're going to use, whether it's a phone or computer, are charged and work. This includes ensuring that you have access to the network, either for calls or internet communication. Another factor to prepare is to have the number of your supervisor close at hand, in case you need to call your supervisor if an emergency arises where you need immediate assistance and additional help. If possible, it's also good to have psychoeducation materials to share with people in distress so they can understand their reactions better, or with tips and advice on how to manage different situations that they can refer to after your communication with them is over. Examples are short leaflets on good habits to promote sleep, or information on stress management, or tips on how to support children in distress. A key part of preparing to support people remotely is to have updated local referral information, and if possible, know the different protocols for referring people to different services. There may be, for example, specific protocol for referring someone who has experienced sexual assault, or in situations that involve child protection services. If you're not able to access such referral information, it's important to find out if your supervisor has this information or who you can call if you need it. Lastly, during the times of COVID-19, it's important to have the latest information on what the local protocol is if someone suspects they're infected and where they can access different types of help. Many people experience distress because they lack information or because they've received false information, and helpers need to recognize and rectify false information. This diagram shows the different actions that may be taken to provide support to staff and volunteers in a time of a crisis response. The first step to support is to have an initial assessment meeting with the team, during which the team leader looks out for signs of distress. If volunteers and staff do not show any signs of distress, it's recommended the team leader arranges either an informal or formal gathering to show appreciation. During an appreciation meeting, the team leader is given yet another opportunity to look out for signs of distress. If none arise, the team leader should just continue with regular staff and volunteer support. If, however, after the initial assessment meeting, it is clear that one or more staff or volunteers show signs of distress, the team leader has a choice of whether to provide individual support or group support. If it's most appropriate to provide individual support, this will usually be done through an informal check-in meeting or in a more structured meeting where the team leader provides psychological first aid to assist the person in distress. If more than one person is in distress, the team leader may choose to provide group support. This can be done through a PFA and support meeting. It's recommended a group PFA and support meeting is held after a few days after a difficult event, but not more than 14 days after, to be most effective. If staff and volunteers continue to show signs of distress after individual or group support, it's of utmost importance that team leaders continue to follow up and assess what further support is needed. If an assessment has revealed an individual staff or volunteer are in distress and need individual support, this can be done through an initial check-in with the person, and if needed, a scheduled and more structured PFA meeting. It may be a team leader who suggests this meeting, or it can be at the request of the staff or volunteer themselves. The purpose of an individual support meeting is to create a safe space where a staff member or volunteer can talk about their experiences or their feelings of distress. It's an opportunity for the manager to help normalize reactions to distressing events, encourage social support, promote help-seeking behavior, and focus on positive coping strategies. In some cases, referral to other services or sources of help may be made. It's also an opportunity to promote self-care and peer support. If the individual is in distress because of work-related issues, it's important to ensure the staff or volunteer also has access to supportive supervision, which is explained more later in this module. Individual support meetings usually take from 15 minutes to an hour depending on the situation. You've learned about the 3 action principles of look, listen and link in the basic training on PFA for COVID-19, and you can also learn more about how to communicate in a supportive way remotely in the additional training module on remote supportive communication. An important way of supporting a team is to show appreciation and recognition for their efforts and hard work. This can be done in various ways. For example, a team leader may gather staff and volunteers together informally at short notice, where a team leader makes a short speech of appreciation to the team. This is also an opportunity to give information relevant to the situation the team is facing. It's important the team members also have an opportunity to say a few words. More formal meetings can also be used to show staff and volunteer appreciation for their work. More formal meetings need to be well prepared and usually follow a planned structure and can involve different key persons expressing appreciation and recognition. This gives staff and volunteers perspective, dignity, and meaning in their work. If some of the team members show signs or symptoms of distress, the team leader may decide to arrange a group PFA and support meeting. Such a meeting usually takes place 2 to 3 days after a specific event. It's recommended not to exceed 14 days before arranging a response. The team leader may facilitate this meeting or arrange for another facilitator who's trained in providing PFA in groups to join or run the meeting. Providing PFA to a group involves the same action principles of look, listen and link, but with added elements and skills needed due to the group setting. The facilitator or facilitators of a PFA and support meeting needs to be able to communicate with the group in a manner which ensures that everyone feels heard and included. They also need to be able to manage group dynamics and interactions, draw on strengths and resources of individuals and of the group as a unit. They also need to be able to encourage and enable peer support, handle difficult reactions and disclosures, and provide relevant psychoeducation to the group. A PFA and support meeting should provide a safe space for participants to talk about their experiences and feelings in a supportive environment where others listen without judgment and where reactions to crisis events are normalized, peer support is encouraged, and information about available support systems is shared. Participants gain perspective from hearing others share their experiences and feelings and from learning about others' positive coping mechanisms. Providing PFA in groups helps to promote social cohesion and connectedness and is a platform for developing and strengthening already existing social and peer support, for example, through buddy systems. It can be reassuring for participants to know that there are others who are experiencing some of the same challenges as them, and in this way they can inspire and learn from each other. Depending on the number of participants, PFA and support meetings can take from 45 minutes, if you have about 3 to 5 participants, up to 2 hours if you have around 10 participants. It's recommended that there are not more than 10 participants in such a meeting. You can learn more about how to run PFA and support meetings in the training on group PFA developed by the Peers Center and available on their website. Peers are a vital source of support during and after crisis events, as they may have similar challenges and understand what a person is experiencing and feeling. Promoting peer support is helpful during a support meeting, but also after the support meeting. The aftermath of a stressful event may be an opportunity for strengthening peer support amongst groups of staff and volunteers. Buddy systems consist of a minimum of 2 people who are linked with the purpose of supporting each other. Working in the field or in a delegation, they watch out for one another's safety and check in with each other through the day to see how the other person is coping. A buddy can, for example, suggest the other to take a break if he or she is showing worrying reactions to an event or signs of high stress or negative coping. Buddies can also support each other after a crisis event to reflect on the experience together. Staff and volunteers often create their own buddy pairs informally, or buddy systems can be initiated by those responsible for care and support of the team, such as team leaders and managers. If creating pairs, make sure that everyone will be part of the system and gets a buddy that they feel safe around. Buddy systems do not work if team members feel forced to pair with someone that they're not comfortable with. One of the most important ways of supporting staff and volunteers is promoting self-care. What are some suggestions you would make to staff and volunteers for self-care? Pause the video and list some suggestions you would make to staff and volunteers to promote self-care. Here are some of the ideas I had that one could suggest to promote self-care. Take adequate breaks. Use peer support. Talk to friends or colleagues about how you're feeling. Seek social connections. Eat healthy. Sleep well. Keep hydrated. Exercise every day. Avoid alcohol and use of substances. Do things you enjoy, and remember to ask for help when you need it. After providing support to staff and volunteers, either individually or in a group, it's important to follow up after a short period of time to see if their feelings of distress have reduced or stopped. Follow-ups can be informal check-ins, or they can be more formal communication, for example, regarding agreed referral or other actions. An important feature of a structure set in place to care for staff and volunteers is supportive supervision. Supportive supervision is slightly different from the support provided if one or more persons are in a state of distress. Supervision does focus on staff and volunteer well-being, but more in relation to work tasks. The main goal of supervision is to create a safe and collaborative space to promote the quality of work, technical competencies, and well-being of the person being supervised. The cornerstone of supportive supervision is the supervisor and supervisee relationship that enables joint problem solving and the discussion of challenges, cases, and collaboratively enhances service delivery. Supportive supervision can help to reduce work-related stress and improve feelings of competency and efficacy. Supervision can be provided individually or to a group of staff and volunteers, where participants are asked to reflect and share some of their work-related challenges. It can also be fostered between peers who meet to discuss work-related difficulties in a space created for mutual learning and sharing. Finally, supervision can of course also take place live, where a supervisor observes the interaction between a staff or volunteer with a service user, and then provides support and guidance on how to improve their interaction. You can read more about supportive supervision in a guidance note that's available on the PS Center website. You might wonder why monitoring and evaluation is part of caring for staff and volunteers. This is because M&E tools can be used to assess how staff are doing in 2 different but related ways. Firstly, M&E tools and practices allow us to assess work performance, which is often related to staff and volunteer well-being. When people feel well and strong, they are also usually able to work well. Thus, if work performance is low, this is a cause to assess how staff and volunteers are doing and if they're coping with their work or personal challenges. The other way M&E can contribute to caring for staff and volunteers is to include some indicators and tools to measure volunteer and staff well-being regularly. This requires including staff and volunteer well-being as a desired outcome in programs, together with planned activities and budget allocations. You can read more about monitoring and evaluation during COVID-19 in a document found on the PS Center website. Have a look at the following small videos prepared by team leaders from different countries, sharing their experiences and tips for how to support staff and volunteers during this time.
My name is Ismail Yusuf. I am Ethiopian Red Cross Senior Psychosocial Support Officer.
So how is Ethiopian Red Cross supporting their staff and volunteers in this crisis?
We already have a buddy system and a peer support system. That is the way we use for supporting our staff.
And how are you checking on whether they are coping well during this crisis?
In this COVID-19 period, we increase our conversation through phone calls regularly, like in 2 days, in 3 days for regional staff and volunteers. And also in Addis Ababa, we meet daily and check up on them regularly.
What changes have ERCS made to accommodate the COVID-19 impact?
Ethiopian Red Cross Society provide an orientation for staff and volunteers about COVID-19, how they can protect themselves and how can they provide service for beneficiaries. And we provide that, and we also provide protective equipment to make them they are safe in this response.
Have you noticed any stress factors with volunteers and staff?
Yeah, we noticed that our volunteers and staff fear to get infected and also to be contagious for families and friends, and also they have a fear because in early times there was no enough equipment to protect themselves. Yeah.
And what did you do to manage this risk?
Yeah, to manage the risk, we trained them about risk communication and community engagement, on how they will support the community, and also about the use of the personal protective equipment, and also about the stress management related to the COVID-19.
Have you any specific tips that you think would be good for other team leaders to know about?
Yeah, I have a tip we need to be more supportive and empathetic to our volunteers and staff. They need our support and attention, and also we need to work with them together regularly. That is what I am doing currently, deploying with them together and follow and support them regularly.
Okay, thank you.
ما هو اسمك وعملك في جمعية الهلال الأحمر العراقي؟
اسمي عماد هادي صباح من الفريق الوطني للدعم النفسي الاجتماعي بالهلال الأحمر العراقي.
بشكل مختصر، ما هي الضغوطات التي يواجهها الموظفين والمتطوعين في الوقت الحالي؟
لقد كان التكيف مع الوضع الجديد تحديا منذ بداية انتشار الوباء. كانوا قلقين بشأن سلامتهم، وبنفس الوقت الخوف من نقل العدوى لعوائلهم.
تقدمون الدعم للموظفين والمتطوعين، وما هي الآليات الموجودة وما هي الطرق المستخدمة؟
في جمعية الهلال الأحمر العراقي لدينا نظام دعم غير رسمي للمتطوعين على مستوى المقر العام والفروع، مما يعني أننا نبقى على اتصال وثيق في جميع الظروف خلال وقت الاستجابة لفيروس كورونا المستجد. لقد قمنا بزيادة اتصالاتنا وادخلنا نظام المرافقة، وبهذه الطريقة يقوم كل شخص بالتحقق من زميله وكذلك رعاية نفسه. كما أننا لدينا موظفين من فريق الدعم النفسي الاجتماعي على مستوى الفروع، نعقد معهم اجتماعات أسبوعية ونتبادل طرق التعامل مع الضغوطات، وذلك لضمان الوصول لكل الموظفين والمتطوعين إذا كانوا بحاجة لمساعدة.
أبرز التغييرات إن وجدت التي ظهرت لاستيعاب تأثير الفيروس من خلال الرسائل الجماعية أو المكالمات بدلا من الاجتماعات.
نحن نعقد اجتماعات منتظمة مع الموظفين والمتطوعين لمساعدتهم للتأقلم بطريقة أفضل مع الظروف المتغيرة، وهذا يوفر أيضا فرصة لطرح الأسئلة ومشاركة مشاعرهم. بالإضافة إلى ذلك قمنا بعدة تدريبات عبر الإنترنت، ومنها الإسعاف النفسي الأولي عن بعد، وإدارة الضغوطات، وكذلك الإحالة الآمنة التي لا تساعد فقط المجتمع وإنما أيضا المتطوعين والموظفين.
أي نصائح خاصة أو أشياء تعتقد أنها مفيدة لقادات الفرق للتفكير بها في هذا الوقت؟
التواصل البشري هو أهم شيء أثناء انتشار فيروس كورونا المستجد. أود أن أشجعهم على التواصل مع بعضهم البعض عبر وسائل التواصل الاجتماعي، وبالمقابل أشجع الفرق على القيام بنفس الشيء. شكرا جزيلا.
Hello, I'm Elisa Chang, one of the technical advisors from IFRC Reference Center for Psychosocial Support. During COVID-19, staff and volunteers from the Red Cross and Red Crescent movement have been facing different kinds of stressors. Because of the pandemic, there could be like a rise in the operational needs. There is also a change in the modality of how we serve our clients. During our service or our emergency operations, staff and volunteers may also be worried about their own safety and health. At the personal level, they may also be struggling in handling the changes in their personal life, for example, of the work arrangement. Some of them may need to work from home, and at the same time, they may also need to take care of their children. So actually they are balancing a lot of different things at the same time. In order to support our staff and volunteers, it would be important to have a structure in place. By means of structure, it is more than mental health and psychosocial support, but also an HR and also volunteer management measures. We should inform our staff and volunteers about the risks and also the needs of the emergency operations. Things that national societies employed to protect our staff and volunteers. For example, the insurance packages or protective measures to ensure the safety. At the same time, team leaders and staff leaders should also be equipped with ways to support our frontline workers. This could mean that we should reinforce the ideas as a helper. It is very important for us to first take care of ourselves before we can help other people, especially during this difficult period of time. When physical volunteer gatherings are not feasible, we may consider moving them online. We may have some volunteer gatherings or some semi-formal discussions with them through some online platforms. We may also show our support through some messagings and also through the phone calls. And it is very important for us to remember appreciating the efforts of our frontline staff and volunteers are utmost important during this difficult period of time. Team leaders may also be more innovative when planning for services during the pandemic. In some situations, it would be impossible or not very good for volunteers to come back to the headquarters to provide their support. In situations like this, we may think of some more innovative ways for volunteers to be able to contribute even when they are staying at home. At the same time, it would be a very good idea to gather the volunteers and staff and to ask for the input into the modalities of services. I'm sure that you can get some wisdom from this devoted group of Red Cross and Red Crescent people.
Here are some sites where you can access more information on how to help in the COVID-19 response. You can also listen to the podcast on caring for staff and volunteers found on the PS Center website. Thank you so much for participating in this training on caring for staff and volunteers during COVID-19. Please keep safe, wash your hands and keep physical distance, stay socially connected, help those around you so they can cope better, and remember to look after yourself and your well-being.